Hello, my name is Dr. Tiffany Lowe Clayton. I'm an obesity medicine specialist as well as vice chair of family medicine at Campbell University School of Osteopathic Medicine. And I'm going to talk to you today about lifestyle and obesity. When we talk about obesity, we must start with truth and compassion. Obesity is not a lifestyle choice. It's a chronic, complex, relapsing disease. It's shaped by genetics, hormones, environment, stress, sleep, medications, and just the biology of appetite and metabolism. And like high blood pressure or diabetes, it requires long term evidence based care, not blame or shame or oversimplified advice. So when I meet patients for the first time, I remind them that this is a journey. It's not about perfection or willpower, it's about partnership. Weight loss is not linear. And I remind them that this journey is an ongoing attempt to get to a healthier lifestyle. Even something as modest as 5 to 10% weight loss can meaningfully improve health conditions like high blood pressure, blood sugar, liver health, mobility, and just overall well being. But no one single tool gets us there. Long term success requires comprehensive, individualized care, along with nutrition, movement, behavior support, and when appropriate, medications, and sometimes even bariatric surgery. Because obesity impacts every system in the body. Patients benefit from a multi professional team to be able to help them get there so that they don't feel like they have to walk this road alone. And so I want to encourage you to speak openly about your goals, both medical and personal, with your healthcare provider. Tell us what you are hoping for, what's been difficult, and what support you'll need. Because when you feel safe to share your full story, we can then create a treatment plan that's both effective and sustainable. When I think about lifestyle change for obesity, I separate it into two phases: active weight loss and long term maintenance. The strategies connect, but the goals are different. During active weight loss, we need to focus on a consistent, sustainable, healthy eating plan that will ultimately give a decreased total energy expenditure or the amount of calories that you take in a given day. This will often include a very structured plan built around lean protein, high fiber vegetables, whole grains, healthy fats, and limiting sugary or ultra processed foods. I also encourage you to monitor those intakes on most days, because through an app or a phone or even simple logging, when you monitor, that's when change can really happen. For movement, I'd suggest working towards 150 to 300 minutes a week of moderate cardiovascular activity, along with strength training at least twice a week to preserve your muscle function and your metabolic health. As far as behavior, stress management, prioritizing sleep, and meal planning, along with problem solving around whatever triggers or stimuli that you may have that may cause you to go off of your plan, are going to be extremely important as well. We want to ensure that everything that you do supports your weight loss journey and doesn't unintentionally sabotage those goals. And so working with a variety of interprofessional people like a behavioral health specialist or with your primary care provider or even an obesity medicine specialist will be really helpful for you to come up with those strategies. Once you achieve a meaningful reduction in your weight and in your health risk, we shift to maintenance, where the goal is no longer continued to have weight loss, but now protecting the progress that you made. Tracking may be less intensive, but some of the regular self monitoring remains important, such as weekly weigh ins or returning to structured logging if your weight begins to rise again. Physical activity remains key. Often 2 to 300 minutes per week of aerobic activity plus ongoing strength training is going to help to prevent weight regain. And during the maintenance phase, your visits will typically lessen to every 1 to 3 months. But it's with the understanding that your follow-up will begin to tighten if the weight begins to drift up and you start to have difficulty with some of the goals that you had set for yourself. Whether the visits are virtual or in person or hybrid, the message remains: obesity is a chronic disease and has to be treated as such. patients don't graduate. They transition from intensive treatment to long-term support designed to keep them healthy over time. Regular follow-up is one of the strongest predictors of long-term weight loss success. We see this consistently in the data. Patients who stay connected with their healthcare provider, whether it's through in-person or virtual visit check-ins, maintain significantly more weight loss over time than those who try to go at it alone. Studies from real-world obesity clinics and the Look Ahead and Diabetes Prevention Program trials show that people who continue regular touch points with a provider maintain 2 to 3 times more weight loss at 1 to 2 years compared with someone who may discontinue care. What does that mean? Continuity matters. Ongoing follow-up allows us to monitor early weight regain, adjust medications, reassess nutrition strategies, troubleshoot barriers, and re-engage behavior techniques before small slips turn into major setbacks. It also provides accountability, something that evidence shows is a powerful driver of long-term adherence. In contrast, patients who stop follow-up assume they can maintain their weight independently, but the data tells us a different story. Most regain 30 to 50% of the weight loss within the first year and up to 80% within 5 years when consistent support is absent. This isn't because of lack of discipline. It's because their physiology has shifted and requires continued management. Regular follow-up is not optional. It's part of a standard chronic disease care. Just as patients with high blood pressure or diabetes need ongoing monitoring, patients living with obesity need scheduled, proactive visits to protect the progress they've made. Medications for obesity are also powerful tools, but they're tools for the right patients. These treatments are meant for individuals with chronic disease that impacts their health, not for cosmetic weight loss or short-term slimming. When used appropriately, medications help us treat the underlying biology of obesity, especially metabolic adaptation that increases hunger, slows down metabolism, and drives weight regain after initial weight loss. Many patients also ask me, how long do I need to stay on this medication? And the honest answer is, as long as you want the health benefit. Obesity is a chronic condition, so when medications are stopped, the biology of weight regain returns. It is not failure, it's about physiology. Your body is actually doing what it's designed to do in trying to preserve the weight that you've lost. Long-term medication helps to quiet that heightened hunger and also supports the body in maintaining the healthier weight that you've achieved. To stay compliant, it's important that you speak with your healthcare provider about simple strategies. Take the medication consistently, start low and go slow with dose increases, eat smaller meals, avoid high or heavy foods that may worsen some of the symptoms that we see, and stay well hydrated with non-sugary beverages. If you start to have any side effects, make sure you communicate that early with your healthcare provider so that they can help you to manage the side effects so that you can stay on your medication. But the most important message is this: medication alone is not the cure. And lifestyle modifications alone, that's not the cure either. It actually takes the combination of personalized medication therapy, sustainable lifestyle changes, and consistent follow-up with your healthcare team to get the best results. This is not a quick fix. It's a long-term strategy for maintaining long-term disease. And when we treat it that way, you'll begin to thrive.